How's it going, guys? It's Miss Perry. Hope everybody's doing well, staying well. We're good over here. So let's get started with 12.1. We're doing disease and the body's immune system. All right, so disease is any condition that interferes with normal functioning of your body. And there's two types. You've got infectious and non-infectious. So infectious is just what it sounds like. You've got a pathogen that has invaded your body. A non-infection is caused by something besides that. All right, and there's disease classifications. One is chronic, and that develops and worsens or does not resolve itself. Acute, the symptoms appear and change, and it's very rapid. It's not long term. So chronic is long term, and acute is not. Okay, so let's talk about non-infectious diseases. So these are usually not transmitted by a pathogen or any kind of personal contact. So this is from your immune system, genetics. It can be inherited, hormones, or other things in your body that are causing this to happen. And we're going to talk about that in the rest of the notes. Okay, so the first type is degenerative. Tissues and organs gradually lose their ability to function. And one of the best known ones is arthritis. Arthritis is a degenerative disease. And it causes the bones and joints to deteriorate. It's very painful. The symptoms are stiffness, pain, and swelling of multiple joints. You probably know somebody that has arthritis. You might even have arthritis from some of the sports that you play. It's not just for old people. Okay, and you can have the treatments usually are pain relief, like Tylenol, or all the way up to prescription pain relief, and something to reduce the swelling, so like an anti-inflammatory. Arteriosclerosis is hardening of the arteries is another name for it. And what it is plaque is built up on the walls inside the blood vessels. So this is the plaque part, and that's not supposed to be there. That's usually built up from not a very good diet, like you eat a lot of high fat foods, you have high cholesterol, things like that. That's when that starts building up. And if you notice, it's making the path for the blood vessels much more narrow. And so that's going to prevent proper blood flow. And those are the kind of things that can cause problems like heart attacks and strokes. Macular degeneration, you may not have heard of this one. This is when part of the retina is damaged, and then parts of it will float around and obstruct the vision. That is age-related normally, and sometimes that's hereditary. So the pictures are showing you kind of what it looks like when you have it. The person who gets it may not notice it to start with, and then it just gradually gets to be like that, where you have little spots where you can't see. Parkinson's disease is a nervous system disorder that affects movement. It causes the tremors, stiffness, or slowing of movement. And this is also progressive, so that's considered degenerative because the symptoms get worse over time and the body does not work the way it should. Okay, so autoimmune disease is when your immune system attacks your body. Lupus is a good example of that. It's where the immune system is attacking the body and making antibodies. So that destroys or injures the organs, and that can include the kidneys, brains, and heart. Symptoms include a rash, and you may see a rash on the face. Um, Joints and muscles are aching, a lot like arthritis, and you may have redness and swelling in the joints. So sometimes when people get lupus, it looks like arthritis to start with, and then the doctors can test to make sure if it's lupus or arthritis. Okay, fibromyalgia is a very painful disorder. It's really difficult to diagnose. At one point, people didn't think it actually existed, that it was just all in people's heads. But it actually is a disorder. It has a lot of different symptoms. It just kind of makes your whole body ache and affects your entire body. So this is usually treated by pain meds, rest, dietary supplements, things like that. Colitis and irritable bowel syndrome are similar. They're both inflammatory disorders that affect the intestines. Um, Ulcerative colitis is it affects the mucous membranes of the large intestine, and irritable bowel syndrome. Sorry, I can't talk this morning. Um, has Causes nausea, pain, gas, and diarrhea. And irritable bowel syndrome and colitis both are affected by diet as well. So certain types of diet, certain types of foods, or stress can make them worse. Chronic fatigue syndrome is where someone feels tired all the time. They don't have energy to do the tasks that they need to do, and things tire them out really quickly. Other symptoms, you'll see those listed here. Things like headache, fever, depression, poor memory. The treatments are improved nutrition, rest, exercise, that kind of thing. All right, so autoimmune disease are not the same thing as immunological disease, even though it's in the same category in your book. Um, Autoimmune is where your body kind of attacks itself, your immune system attacks the body. And immunological disease is caused by a malfunction of the immune system. So they're not the same thing. All right, so allergic reactions, you may have had things like this. It's just a reaction to an allergen or some type of antigen. Allergic reactions are like if you're allergic to pollen, things like that. You know, you'll go outside, then you start to sneeze and have red, itchy, watery eyes, things like that. So that's what an allergic reaction is. Usually gets worse with time and increases with exposure. So if you're just a little bit sensitive to pollen, it can get worse over time the more you're exposed. All right, and hay fever is what a lot of people have this. It's when you're sneeze when you're around flowers and weeds and things like that, sneezing and itchy, watery eyes. It's very similar to just allergic reactions, like we just said. Hay fever can run in families. You can take antihistamines, allergy pills, things like that can help with that. Okay, asthma is pretty common. It's characterized by issues with the lungs. So people with asthma can have shortness of breath, coughing, wheezing, which is you can you don't have the clear breathing like most people do. It can be triggered by a lot of different things: dust, smoke, pets, exercise. Um, if you're in a place where it's not clean, with dust mites and things like that. With asthma, avoiding triggers and reducing exposure is really good. There are some medications that will help with it, some that will help with the allergic reactions that aggravate it, and then some that will reduce attacks. Now, bronchitis is an extension, it's another step from asthma, and that's actually an inflammation of the bronchial tubes. So when the bronchi become inflamed or infected, you've got less air that can flow from the lungs and heavy mucus forms. So this can be caused by, this can be like a one-time thing where somebody just gets sick and they start having, they having problems with their lungs where they're just kind of congested. Or it can also be chronic if someone smokes or there's a lot of air pollution. If they're around a lot of dust and fumes, those also can cause it. So it can be chronic and it can be short-lived. Some people have bronchitis like every winter. So if you know someone who has that, sometimes it's just a periodic thing. Now, there's also hormonal disease, and this is a malfunction of the endocrine system. One of the main ones that is in this category is diabetes, and that's where the pancreas fails to produce enough insulin or the body doesn't use insulin effectively. Now, insulin is produced by the pancreas, and the body needs it for metabolism of carbohydrates. So you can measure the doctor if they think that you have diabetes. You can they will measure your blood sugar. You may have they do like urine tests. Some of the symptoms that you might notice if you are going if you're becoming diabetic is excessive thirst, frequent urination. Slow healing wounds is a big risk with diabetes, or tingling in the extremities. It can also affect vision, and it can cause problems if your wounds are healing very slowly. So with diabetics, some of the main things they have to look out for is balancing their diet and making sure that they avoid wounds. So to control diabetes, sometimes insulin is taken orally or through injections. Diabetics normally monitor their blood sugar several times a day, eating a carbohydrate-rich diet. And these are things that are high in fiber. These are complex carbohydrates. And losing weight and getting regular exercise. Okay, PMS. A lot of women have this. It's where you have symptoms at the same time or right before a period. And these symptoms are very real. Some women have it much worse than others, but it can include depression, irritability, headaches, things like that. Therapies can be hormonal therapies, pain meds, caffeine and salt irritate it, and increased carbohydrates, and stress reduction and exercise. Endometriosis is another problem that affects women. It's an abnormal development of the tissue outside the uterus, and symptoms include cramping between periods, and they're sometimes irregular. There's other things that can be indicators. Doctors can usually figure this out, but it is very painful, and it can cause infertility. So this is one of those things that if women are trying to have children, that sometimes they need, they have issues with this that will prevent them from getting pregnant. So that's one of those things that doctors can treat that to a point. Okay, on to neurological diseases. These are caused by malfunction of the nervous system, and just regular old headaches can sometimes be issues with the nervous system. Some headaches obviously are worse than others. I'm sure everybody here has had headaches. You can have tension headache, which is just your muscles are tight in your neck or around your face. Then there are migraines. Migraines are very, very painful. Um, Most of the time with migraines, you have pain on one side of the head. You can have vision disturbances, and normally light and sound will irritate or make it hurt more. So normally people with migraines have to just get in a dark room with things that irritate it less. But the big indicator for a migraine is that it's on one side of the face or one side of the head. Secondary headaches can be caused by sinuses. You know, you have allergies. Um, you have some type of injury. They're also caused by high blood pressure. There's several different things that can cause those. Okay, another issue with the neurological diseases is epilepsy. This is a very serious condition, and this is caused by abnormal electrical brain activity. It can also be accompanied by loss of consciousness or convulsions. And most of the time, when people are epileptic, they have things that they know they need to do. They know they have maybe medication. They may have like a bracelet on their wrist or something that identifies them as epileptic. So if they have a seizure around people that don't know them, then they know that. Um, if you ever know someone, if you have someone have a seizure when you're around, there are a lot of really important things you need to know. And these are some of them listed. You want to turn them on their side. Um, don't try to restrain them, but make sure that they can't hurt themselves because they're not doing this on purpose, and they'll be fine afterwards. But just make sure that they don't hurt themselves. Have them on their side, cushion their head. If there's something in their mouth, then take that out. But it is not true that you can swallow your tongue, so don't worry about things like that. But just know the things to do. Take a look at these and know that these are things that if someone has an epileptic seizure, that these are the things that you should do. Okay, there's a couple of different things. I'm going to kind of lump these in the same section because they're in the same section in your book. But there's two different types of genetic diseases, things that are inherited. One of them is congenital disease, and these are like birth defects, things that are present at birth. A genetic disease can be things that are inherited. They're not necessarily present at birth, but they are things that are inherited from, parents or grandparents or that kind of thing. All right, so birth defects include cystic fibrosis. This is a disease that affects the lung and the digestive system. It produces thick and sticky mucus. It can clog the lungs and obstruct the pancreas. So people with cystic fibrosis have to have respiratory therapy to clear this out of their lungs so they are able to breathe. And it's a very serious disease. Sickle cell anemia is an inherited red blood cell disorder. Where's my picture? Nope, that's not my picture. Sorry, I lost it. It's an inherited disease where there aren't enough healthy red blood cells to carry oxygen throughout the body. And the one thing with sickle cell anemia It actually is a different shape of the red blood cells. They're shaped like little sickles or crescent moons, and they get stuck when they are trying to go through the blood vessels, which can back up and block the blood flow and decrease oxygen to parts of the body. Sickle cell anemia can be very painful, and it is something that affects mostly people of color, but it is a very serious thing that is inherited. Down syndrome is a condition where someone has an extra chromosome, and this is also something that you'd be born with. It varies in severity. It can cause intellectual disabilities and developmental delays. It can also cause other medical issues, including heart problems and gastrointestinal disorders. And isn't he so cute? Okay. Diseases caused by hazardous substances or nutritional issues. I think these might be separate in your book, but I lumped them in together because they're kind of similar. So let's take a look at these. Emphysema is something that is mostly caused by smoking. It also can be caused by exposure to a great deal of air pollution and inadequate oxygen supply, stress to the heart, and early death. So it's where the air sacs of the lungs are damaged. And it's a very serious disease for usually older people have emphysema, but if someone smokes a lot, then they can get it younger. And it's a very, very distressing disease because you have problems breathing. All right, there's also other types of chronic lung disease. Um, Dyspnea, sorry, I can't pronounce that, is chronic breathlessness. You may get winded trying to climb stairs, or you have sometimes you can have a pause in your breathing when you're sleeping, which is kind of serious. Also, COPD is severe lung diseases, including chronic bronchitis, emphysema, and asthma. Those are all lumped in with COPD. And we have a couple of other little things. You can have repetitive stress injuries. You may know someone who has these types of things. It can be caused by physical stress or repeated motions. Sports can cause this. People who are on computers a lot can cause these. One particular type is carpal tunnel syndrome, and that's where the median nerve in the wrist gets irritated. So this the nerve that's right there, and it can cause irritation and swelling, so that there's pain in the wrist and the fingers and all around the hand. So it's a compressed nerve in the wrist. If you remember that I've had surgery on my wrist, I didn't have carpal tunnel. I had something called de Quervain's, and it's the median nerve that's over here on this side. So there's more than one spot where you can get this, and these can get to the point like mine did where I had to have surgery, but sometimes it's also treated by splinting, changing some of the things, like if you get it from being on a computer all the time or from other types of repetitive motion, those can be adjusted and maybe changed so it's not as bad. So there's a lot of different things you can do with this, but the surgery like I had is like the last thing that you would try. Okay, peptic ulcers are problems in the stomach or the intestines, and it's caused by digestive juices or bacteria in the stomach, and it causes pain that goes away when someone eats but returns later. They can treat this with antibiotics, avoiding certain types of food, avoiding alcohol and avoiding aspirin, because aspirin can damage your stomach lining. Also, if someone takes too many anti-inflammatories, there's certain types that it can also do this. It can also damage your stomach lining. Okay, so that's the last thing I've got for you. These these are not totally inclusive of what's in your chapter. So there's a lot of, you need to know the main ones of every category. So some of the ones that I've said, some of the more well-known ones that are in there already. So you would be responsible for what I have on this PowerPoint, and then also what's in the book. And when we go along the chapters, it's going to be the same when we talk about infectious diseases. Okay, so make sure that you've done the outline for this section, and then we are going to move on from here. All right, guys, take care. Talk to you later. Bye.